So I'm sure you've seen it all over med Twitter, the recent beef between physician associates and doctors, as well as all across the news about calls to try and stop PAs from diagnosing patients, trying to change their name from physician associate back to physician assistant, and having PAs being regulated by their own working body rather than the GMC. So in this video, I'll be breaking down all of my thoughts towards all of this controversy that's going on between PAs, doctors, and the rest of the healthcare team, and hopefully give some clarity to this matter. What is going on, guys? My name is Kenji and welcome back to my channel. Hopefully it's not the first time you're watching one of my videos, but just in case it is, I'm a doctor working in London, and I should probably start by saying this is not going to be a political video. I won't be hating on PAs at all, but the purpose of this video really is first and foremost just to give an open discussion and try and raise some of the issues and controversies that have been going on with PAs, doctors, and the rest of the healthcare staff. And the second reason why I want to make this video is a lot of you guys who watch my channel are interested in becoming doctors or are already training to become doctors. And I think if you have any interest in medicine whatsoever, whether it's to be a doctor or a nurse or any other member of the healthcare team, I think it's super important to know politically what is going on in the government, in your healthcare team, across the different specialties, and how that might affect you and your training as a doctor or a nurse or anyone else in the team. Because truth be told, if you're someone who's interested in becoming a doctor, these other roles that are occurring in the NHS, like advanced nurse care practitioners, physician associates, all of these different career options, they all affect each other. So they definitely will affect your pay as a doctor, it will affect your power as a doctor, your job capabilities, your training capabilities, literally every aspect of your job as a doctor or whatever healthcare professional you are will be affected by the other sort of healthcare professionals that are in your team. So it's super important, in my belief, to understand what is going on and what the different viewpoints are out there currently. So let's actually start by defining what a physician associate is. I think this is a new term that is quite new to the NHS, and not many people actually truly understand what this degree is and what their role is, especially when it comes to patients as well. So I got this directly off of Google. It says that a physician associate is a healthcare professional who works under the supervision of a licensed physician, primarily in the medical field. PAs are trained to perform a wide range of medical duties, including taking medical histories, performing physical examinations, diagnosing illnesses, developing treatment plans, ordering and interpreting diagnostic tests, and assisting in surgeries, supposedly. They often work in collaboration with physicians and other healthcare providers to deliver comprehensive patient care. PA programs typically involve a combination of classroom instruction and clinical rotations, leading to a master's degree qualification. While the scope of practice for PAs may vary depending on the country and healthcare setting, the role is generally designed to complement and support the work of physicians in delivering high-quality healthcare services. So this is the official definition that I got off one of these healthcare websites. And this definition is actually quite interesting. It highlights some controversial points, particularly to do with working under supervision and stuff like that. But to become a PA, generally you need to undertake an undergraduate degree. And in my understanding, it doesn't necessarily have to be in a science-related field. So you could have studied history or art, and then study 2 years studying in PA school where you learn the basics of medicine and science as well, to then qualify, like I said, with a master's degree qualification to become a PA. So the second point I want to talk about is what are the actual benefits of working with physician associates? Now, I have worked with a number of PAs in different roles in medicine, in psychiatry, in surgery, in loads of different roles and fields of medicine. And when applied in the right environment and under the right supervision and in the right context, I can definitely see how they may benefit the team and also how they might benefit patient healthcare. PAs can help the medical team and provide additional support to physicians. So for example, they can help physicians take histories, and they can make assessments, help formulate treatment plans and follow-up care, and thereby allowing for more comprehensive assistance with helping deliver patient-centered care to our patients. PAs can also help increase access to care. So for example, the NHS has huge numbers of waiting lists. They're also seeing a huge load of patients coming to our hospital. And if we can have PAs who can help with taking histories, performing examinations, and helping with all of these roles that are involved in looking after a patient, it can definitely, one, improve access to care, and secondly, it can also help alleviate the large workload that doctors commonly face, especially also environments where, getting access to a doctor, maybe in third world countries and in, systems that also are overloaded by a huge number of patients. That can also help definitely in those areas as well. So there definitely is a place for PAs. But the problem is, like I will talk about later in the video, they need to be under correct guidance, correct supervision, and in the correct context. So we will touch on that in a second. Now let's actually go ahead and talk about the current controversial issues that are affecting PAs and why a lot of doctors seem to have a negative opinion when it comes to PAs practicing. Now the first and probably the most important one is the increased funding from the government, where there is no increased funding for the training of doctors. So let's take this year as an example, guys. This year there were around 7,000 applicants to specialty training to become a GP and only 4,000 spaces available. And what that means is that essentially there were 7,000 doctors who are not able to successfully gain a training post in order to become a GP. And that's in the UK here alone. And apparently in our country here, there is a shortage of GPs. We know how difficult it is to actually get an appointment with our GPs, but unfortunately there is not enough spaces and not enough money essentially going to fund doctors who want to train to become GPs. And this is the same case not just to GPs. Across every single specialty, there are an increasing number of doctors coming into our country from abroad, but also an increased number of doctors being trained here in the UK. However, the actual training posts to train these doctors to become specialists is not growing to match that increasing demand of doctors who are entering the healthcare field. So there essentially is a bottleneck in training, and it's the same not just for GP, it's the same for other specialties like cardiology, dermatology, whatever. The number of competition ratios or the difficulty it is to get into a particular specialty training program is getting much more difficult year on year, and these numbers of training positions are not increasing. And it doesn't actually stop there. Once you complete your training and you finally finish your 7 years or 4 years or whatever it is that you've trained, in order to actually get a job as a consultant or an attending physician in America, you have to compete again, and there is another bottleneck in order to gain that consultant position, because again there are not enough positions for consultants compared to the number of people who are qualifying and completing their training and then want to actually get a job as a consultant. There is a second bottleneck essentially in your training. So the controversy that is raised with this issue is, why is it so difficult for these doctors to enter specialty training programs and then to become a consultant? Why are these numbers for training programs not increasing even though the number of doctors in the country is increasing? And while this is happening, and whilst we have a shortage of doctors in our country, why is the number of PA training positions increasing year on year? Like this year alone, there was literally thousands of jobs and training positions created for PAs and not necessarily for doctors. So we're funding PAs, we're funding their training positions, but we're not doing the same thing for doctors, and this is why a lot of doctors are upset and stressed out. So the government's solution to this problem just seems to be, let's just train more doctors in our country and let's just import more foreign doctors to enter the NHS. But what they don't understand is that it's not necessarily an issue of supply, it's an issue of not having enough training positions for the current doctors who want to actually get into training, number one, and also number two, the poor retention of its own doctors. So a lot of doctors who are trained here in the UK are leaving to other systems like America, Canada, Australia because of the poor working conditions and the current issues that junior doctors are facing in the NHS, and therefore leaving medicine as a whole or leaving the NHS to go work in other countries. But it seems to be a discrepancy between what the government wants and what they think the problem is and the actual problems that junior doctors are facing. Now, the second reason why a lot of doctors seem to be frustrated by this issue is unclear guidance on how PAs can work and also in what capacity. Now, when you become a doctor, there is very clear guidance from the GMC, who are the governing bodies of the doctors, about the capacity in which you're able to work. So that means who supervises your work, what you are and what you're able to do, and also where exactly you're able to work, whether that's, for example, in a GP or in a hospital. So there's very, very clear and strict guidelines on doctors once they graduate. Now, speaking personally from my experience, what I saw was that when I was in my final year of medical school, I had a, I think, 6-week attachment in a general practice. I saw newly qualified PAs who only have 2 years of medical training or medical experience, who were seeing patients independently, and any sort of patient, whether it's a minor thing or potentially a major thing, they saw these patients independently with no supervision requirements. And I remember my GP saying that this was quite unsafe, and when we reviewed the patients that the PA actually saw in that given GP that particular day, the GP actually had to call back the patients that they saw at times in order to change their plans. And there were some times as well where a patient was seen and it actually was missed, like a serious condition was missed. It was thought to be a less serious condition, and again we had to send that patient to A&E. And that's just the experience that I saw. I'm speaking very truthfully. It's not a biased opinion. That's literally just what I saw. I then caught up with the same GP 2 years later. I went and caught up with him, see how things are going. And when I asked him about how the PA, is and how things are going at the practice, he actually told me that he fired the PAs who were working for him because of his, in his opinion, the unsafe practice at which they were working at and putting patients at risk. Now, I'm not saying that PAs should not see patients. I'm not saying that PAs are dangerous, but the issues that are currently being raised is it's quite unclear about which patients they can see and also under what supervision. There's very little guidance for PAs about what they're able to do and what they're able to not do. Now, at that point that I'm talking about, I was in my 5th year of medical school, so I had already done 5 years, or in my 5th year of medical training. I also had 3 years of an undergraduate degree in a science field and a science background. And even though I had that much experience, every patient that I saw had to be discussed by a GP, by my supervisor, before I was allowed to tell this patient the final treatment plan and allowed to let them go home. And that's, 5 years, or if I include my preclinical years, or my last degree, that's 8 years in total there. And also, if we think about how it is now, I'm now, 7 years into my medical training. This is my 2nd year working as a doctor. I cannot get a permanent job to work in a GP, whether that be independently or even under supervision. I can work as part of my foundation training for 4 months in a GP under supervision. However, now that I've almost completed my 2 years of foundation training, I still cannot get a job permanently in a GP. And that's the same case for these, consultants who work in my hospital. If you're a consultant in my hospital and you're a consultant in general medicine, you may have 20 years experience treating patients in a hospital. Even after that much experience, you're still legally not allowed to take up a post in a GP practice as a GP seeing patients, in general practice. That is just not allowed. And that's very different to a PA who is newly qualified, who only has 2 years experience and who can see patients independently with very little or no supervision. And again, talking about the clear guidelines, as an FY1 in my 1st year working as a doctor, I couldn't actually see patients independently without senior supervision. And this kind of ties into the fact that there is currently no governing body who sets the specific standards of practice for a PA, at least in my understanding. It seems the government are actually attempting to regulate PAs under the GMC, which is governing body that regulates doctors, and also potentially give them GMC numbers. But this is something the BMA are actually actively trying to fight against to ensure there is a clear difference between PAs and doctors. Because if we have PAs who are seeing patients in the same uniform as doctors, with stethoscopes around their neck, signing patient documents with the GMC number as well, it will definitely blur the actual grounds between what is a doctor and what is a PA. Now, the next point of discussion is regards to the safety of PAs when actually looking after patients independently. There's been quite a lot of cases on the news recently. I'm sure you've probably seen a few where a PA had treated a patient and that patient unfortunately passed away. Now, the reason why there's so much speculation and controversy is what they're saying is that if a patient was seen by an actual doctor who had, at least 3, 4, 5, 6 years more experience in that particular setting, they're saying that the patient wouldn't have passed away, and these potential serious red flags and these serious signs may have been picked up by a doctor. And unfortunately, the PA who saw them didn't pick up on these signs, which eventually led to the unfortunate death of the patient. And this is really sad and it's really unfortunate. And a lot of work is being done currently to try and bring the PA profession back to what it was originally designed for, which is a healthcare professional who works under the supervision of a licensed physician, primarily in the medical field, like I said before when I defined it. The role is generally designed to complement and to support the work of physicians in delivering high quality healthcare services. But what is happening, or at least what I can see, the role of a PA is changing from what it was originally designed to work under supervision and to help physicians into an independent practitioner who can actually do the role of a doctor. And we're seeing these ever increasing positions where PAs are being allowed to work completely independently with no supervision in place of a doctor doing the same job that a doctor would normally do. And this is raising a lot of concern in the media and across the healthcare community about the potential risk to patients when PAs are working independently with little supervision and therefore potentially affecting patient safety. And again, I'm not saying that PAs are dangerous, that they have no knowledge, but what I am saying is there's currently a lot of work to make sure that they're working in the right capacity with the right supervision to make sure that patient safety is not affected. Now, the final point I want to touch on that a lot of doctors, being upset by is the pay of a doctor compared to a physician associate. Now, when I qualified and started working as a doctor 2 years ago, I was being paid £29,000 per year. That is very different to a newly qualified physician associate who in their first year will be earning significantly more at £41,000. Now, this is raising a lot of concern. And as you can see here, every single year, yes, a doctor's pay does increase, but so does a physician's associate's. And it's not until about 5 years after graduation that a doctor starts to out-earn a physician associate. So 5 years later, after graduation, does a doctor then start to just more than what a physician associate is earning. Now, the reason why a lot of doctors are angry is because it takes a significantly longer time to get through medical training. It's a lot harder to get through medical school. Again, 5 years long. And even a doctor in their first year of practice is still working, debatably longer hours in harder conditions under more stress with more role responsibility than a physician associate would. A doctor, even in their first year, is still ordering scans, which, potentially could harm patients. They're still working on-call shifts. They're still working night shifts and weekends. They're still, prescribing medications that could potentially, again, harm a patient. So even in the first year, a doctor is still doing a lot. We are doing a lot, and the responsibility is crazy compared to a first-year physician associate. In my first year working as a doctor, on a number of occasions, I've had PAs come up to me asking me to order scans for their patients or to prescribe medications for their patients because the physician associate is not able to do this. Now, what that essentially means is that if I agree, and oftentimes I had to agree because they say that the consultant made this plan, essentially I am taking responsibility for this patient who I've never seen before. I'm prescribing medication to this patient. I'm ordering, ionizing radiation scans for this patient who I've never ever known. And again, if something goes wrong with this patient, I will face a lot of scrutiny with the GMC, and I will take a lot of responsibility when it comes to looking after his patients. So pay is a huge issue, and I'm not saying that physician associates should earn less money, but what I am saying is that it clearly is highlighting how doctors are not being valued as they should be and are not being paid as they should be, and hence why, we're striking right now as junior doctors in the country. So I've only just touched on a couple of issues when it comes to what's been going on. Big question is, what can you and I do about it, and what should we do about it? And I think first and foremost, we need to be kind to our team. So no matter whether you're a doctor, a nurse, or a nurse practitioner, there's been a lot of, bullying towards PAs and all of these other associated healthcare professionals. And no matter what you think, no matter, what you are, what you work as, I think we need to respect each other and we need to treat each other equally and fairly. PAs have the same goal of looking after patients. They have the same goal of wanting to help our healthcare system. And a lot of these problems that I've discussed are not with PAs individually. A lot of these problems are, political and governmental issues that are being discussed at a much higher level and is not the fault of the individual PA. So I think it's really important to bear that in mind. In terms of what else you do, now that depends on your own personal view. I think a lot of these points are justified. I think a lot of doctors have reason to be, quite angry and quite frustrated. And if you feel as though these points being raised by the BMA are fair, then what I want you to do is to stand with doctors, to stand with the BMA, and try your best to support the different goals that the BMA are currently fighting to achieve, and the rest of what you do is completely up to you. So I want to leave you with this final point. What is your opinion? What is your own personal opinion when it comes to this issue? Do you think there is a plan or a role by the government to blur the two professions? Do you think there is a plan, maybe to phase out doctors and have this new physician associates be the majority of, who you see when you go to a hospital or a GP? I don't know, but I'd love to hear what you have to say and your own personal opinions. So leave a comment down below and let's have a conversation. Now, I hope this video has been informative in some way or form. If it has done, please leave it a like. Make sure to subscribe and notifications on to never miss another upload. Thank you so much for watching this video, and I'll see you guys on the next one.